Hi, I am Dr. Haresh Dodeja. I am the consultant nephrologist and transplant physician heading the nephrology unit at Fortis Hospitals Mulund. Kidney transplant is the most important treatment for us in India as it is worldwide, but unfortunately we are placed right at the bottom when it comes to kidney transplant because of the legislations involved in our country which are different in different states, and also because of the cost involved, as well as because of the lack of a cadaver transplant program. So we would be having pockets of places in India where transplant would be done in sizable numbers, but by and large most of the places would still not have access to a good transplant program. The challenges mainly are in terms of the legislation. Our law doesn't allow us to use altruistic donors quite commonly, so we are dependent on immediate family members. A law, at least in our state in Maharashtra, is such that if the donor is from out of Maharashtra, many times we have to take permission from the government, so that puts the patient back. Similarly, the problem also involved is in terms of costing. A lot of patients still cannot afford a kidney transplant, which is roughly about 4 to 6 lakhs. The main challenge is that in the world that India is turning into, with a lot of nucleus families, a lot of donors are not available to the patients. So medically we cannot accept donors who are diabetics, we cannot accept donors who are bad hypertensives. So that takes away a lot of donors from our patients, and these patients who are willing, who can afford a kidney transplant, do not have an access to a kidney transplant. So they have to depend on a good cadaver transplant program, which is lacking in practically 95% of India. I think hardly 5% of India has access to a cadaver transplant program. Then we, in that case, we have to move towards how countries like Japan and Korea, where a cadaver transplant program due to their religion is not so prevalent, rely on against the blood group transplantation, what we call as ABO incompatible transplants. We have to move towards that, and we should start doing more number of those. However, still a lot of big hospitals in India are still shying away from that, probably because the experience is limited, but the Western data and the literature and Japanese and Korean experience tells us that they work as well as a normal transplant. That, I think, is the biggest challenge to get the donors for our patients. Dialysis even today is the backbone of a kidney program. Most of the patients, as I said, cannot afford or have access to a transplant, would depend on dialysis for their long-term survival. It is freely available now in our country, but it is still a challenge in terms of costing to make it available to everybody who needs it. With the new Modi government changing some legislation for that and planning to introduce more of dialysis centers which will be available to poor people, I think it is possible. But otherwise, as I go back a decade back when I was in UK, the challenge for us was to find a slot for a dialysis patient. Soon, I think even in our country, we are facing that. Primarily it is because the longevity on dialysis is improving, because our management of dialysis patients is improving. So you can imagine a patient coming on dialysis and occupying that slot for the next 5 to 10 years, and more such patients coming. So we need more and more centers to accommodate them. And that's why I think dialysis will have to be looked at as something which needs to be funded more by the government, a thought given to how well they should be located so that they are accessible to all. Kidney disease basically is increasing in the world now, as far as also in India. It's primarily because the two main causes for kidney disease are diabetes and blood pressure. And as we all know, the diabetes is increasing, the blood pressure is increasing due to whatever environmental and circumstantial factors. So if India is going to be the diabetic capital of the world in the next decade, obviously India will become the capital of kidney diseases in the world also because of this default. So if we have to control the kidney disease, these are the two things which we have to control aggressively: diabetes and blood pressure. Again, as we know, both diabetes and blood pressure are not diseases which can be prevented in most of us by taking some medications. They are generally environmental diseases, so they have to be prevented by adopting a holistic approach, and they don't have a cure, they have a control. So we need to control these diseases better. For that, the most important thing would be to educate the public so that they can adopt the right practices which will prevent them from having diabetes and blood pressure of uncontrolled magnitude, which is going to lead to kidney disease. And secondly, also educating the people who treat them, which means the general practitioners and the physicians, and telling them how aggressively these two diseases have to be controlled so that the disease does not percolate into kidney disease. And these are the two most important things: education of the public in general about how to manage the diabetes and blood pressure so that the kidney disease is controlled, and educating the people who treat them with the various targets. So for example, a diabetic patient, if he maintains a glycosylated hemoglobin at an 8, or if he maintains a glycosylated hemoglobin at 7, the difference between this one of glycosylated hemoglobin translates into almost 4 to 5 years of dialysis time. Similarly, if you maintain somebody's blood pressure at a target level of 160/90 and you bring down the blood pressure of that person consistently to a target of 130/80, you probably save him at least 4-5 years of dialysis time. So these are such simple measures which have such a vast impact on kidney disease that this has to be aggressively put forward to the people who are treating to achieve those targets, and I think we can prevent a lot of patients from requiring dialysis or kidney transplants in future.